Practicing as a medical doctor, I've had the opportunity to come across different patients with different complaints. And one very common complaint is the disturbance of night sleep. And most of the time, let me not say most of the time, but more often than not, many of these people also talk about the fact that they wake up more than once, wake up twice, 3 times, some even up to 4 times to urinate at night. Do you know what that means? Has that ever happened to you? Or are you currently experiencing this symptom? This video is for you. So if you have ever experienced this, or you are currently experiencing this frequency of urination at night, many people sometimes complain about urinating frequently more than their usual pattern during the day. But at night, this could be very disturbing at night. Let me know in the comments what the experience was like. This is usually an unpleasant experience. You can share your experience with us in the comment box. But in this video, I will be sharing with you the common causes, some of the causes of frequency of urination at night, which is medically known as Nocturia. Don't mind my medical jargon. So let's get into the causes. Many people can actually identify this. The common cause, one very common cause of frequent urination at night is, of course, you guessed right, drinking too much water, whether during the day, especially in the evening and close to your bedtime. Of course, apart from water, there are other types of fluids that can make you to wake up frequently at night to urinate. And such fluids include fluids or drinks containing caffeine. Others include alcohol. All kinds of beverages can actually cause this. And one very common reason is the intake of these drinks, especially close to bedtime. So most of these drinks actually act like diuretics. They help to move not just the solus, the fluids from the body out of the system through the urinary tract. Another common reason for frequency of urination at night, nocturia. If you are finding yourself to be peeing more at night, this may be related to aging. Now, what aging does is that it reduces the capacity of the bladder, and this may cause sleep to be lighter, and then there's frequency of urination. Next, another common reason for peeing, frequency of urination at night, is urinary tract infection. I'm sure if you have had this current experience of urinary tract infection, or even one experience, you know some of the symptoms include frequency, urgency of urination. Frequency meaning that you are urinating more than usual during the day, or you are having the increased urge to urinate. And then there is the nocturia, which we are talking about in this video. Other symptoms include dysuria, that's painful urination. Interestingly, some people also have fever when they are having urinary tract infection. But remember, for you to have a proper diagnosis and proper treatment, you must see your doctor. Other conditions related to the urinary tract include overactive bladder. Have you ever been diagnosed of overactive bladder? This leads to early contractions of the bladder and then the frequency of urination. Another important cause of urinary tract infection and frequency of urination, and even at night, is the presence of bladder stone. Bladder stone causes urination, leading to incomplete emptying, and so the individual, you may actually feel the urge to want to urinate more because of this irritation. Next are metabolic and hormonal causes of urination. Diabetes mellitus, high blood sugar, is actually one common cause of frequency of urination and even frequent urination at night. This is because sugar actually pulls water with itself, pulls water into urine. Another diabetes status is diabetes insipidus, which is a rare disorder of hormone function. The hormone is called anti-diuretic hormone, where there is a deficiency or low level of this hormone. Where there is an imbalance in this hormone, this may lead to diabetes insipidus. Another urinary tract cause of frequent urination is kidney disease. Kidney disease, where there is a disease of the kidney, it may affect urine concentration and even passage of urine. Do you know that heart-related conditions can also be a cause of urination, frequent urination at night? Yes. Conditions such as hypertension, which may be complicated with heart failure. In heart failure, fluid collects in the legs during the day and this returns to the bloodstream at night. So with more fluids at night, the body tends to be overloaded and wants to get rid of this water in form of urine. And in fact, the kidneys make more urine at night. Other causes of frequent urination at night include sleep apnea. Yes, sleep apnea. In sleep apnea, there is low oxygen levels, and this low oxygen supply triggers the hormones that increase urine production. So other causes, I'll just share with you two more causes of frequent urination. There are some that are actually related to use of medications. There are certain medications that you may be taking that may be responsible for frequent urination at night. For example, if you are on a diuretic, furosemide, if you are on hydrochlorothiazide, spironolactone, these are some medications that can cause fluid loss and interestingly may make you wake up more frequently to urinate at night. So that's why your doctor may recommend that you use these anti-diuretics preferably during the day, in the morning and not at night, to reduce the effect of this on your night sleep. Some antidepressants can also be a cause of this. Finally, wait till the end because I'm going to be sharing with you what you can do to reduce this experience or these symptoms that you are having. So let's talk about male causes. There are certain male-related conditions that may cause you to pass urine frequently at night as a man. Prostate enlargement, benign prostatic hypertrophy, or even a cancer of the prostate can cause frequency of urination at night because enlarged prostate blocks the urethra, blocks the bladder outlet, and there is incomplete emptying. The bladder senses that there is still fluid or urine in it, and then the cycle continues. There's a trigger and there is still incomplete bladder emptying. Until this is particularly dealt with, the symptom may persist. So let's look at the practical steps, things that can help when you are having this symptom. Before I give you some of this, you need to note that you need to consult with your doctor for a proper evaluation if you are having this symptom of frequent urination at night. So look at this. Practical steps include that you can stop taking fluids at least 2 to 3 hours before you go to bed. This is going to be really helpful. If you have tried this before, let me know. You know, you can actually do it. You can start taking your water. Water is good as recommended, at least 3 liters on the average for adults. You should take this beginning from the morning, waking up, and then through the day. You can take less fluids towards your bedtime. This will really help you. Next, you should consider avoiding or reducing intake of caffeine, alcohol, other beverages that can cause you to have frequent urination at night, and this may disturb your sleep. Next, you can empty your bladder at least 1 hour or close to your bedtime. This is also helpful. And if you are being managed for heart failure, I'm sure your doctor must have told you, apart from medications, you can raise your legs, support with pillow, and even if you are on bed, you can still raise your legs with support of your pillow. And next, you should control your blood sugar and blood pressure if you are diabetic or hypertensive. And I'm sure your doctor has a good management plan for you. So consult well with your doctor if you have any complaint so that you can have this control to reduce the effect of this on your urine habits. So that's it. If you have watched this video up till now, I want to say thank you. Please give this video a thumbs up, and you can share with somebody in your community, a friend, family member, a colleague. I'm sure this will help somebody around you. Thank you for sharing. If you are coming across this channel for the first time, this is a healthy community. You can subscribe to the channel and remember to tap again to click on all notifications so that you can get all notifications when I upload a new video, similar topics, similar videos present on the channel, and more will be coming. Then you will get notified when I put up a post in the community or when I come up live where we discuss and chat as a community. Thank you for joining us, and see you in the next video. Bye for now.